Hello, my name is Gavin Bonsu, and I'll be guiding you through this PowerPoint presentation identifying and discussing post-traumatic stress disorder, found within the film series Peaky Blinders. Which characters are affected by the mental health condition, and what symptoms they portray throughout the film, alongside the requirements they meet and how they fit into the DSM-5 diagnostics manual based on their signs and symptoms. Before we get into the analysis of the film, let's begin with getting a general understanding of what the mental condition PTSD is. Also known as acute stress disorder, post-traumatic stress disorder, PTSD, is a neurocognitive condition that can develop after an individual experiences or witnesses a traumatic event. Situations involving events such as natural disasters, military combat, sexual assault, physical assault, or any life-threatening accidents may result in the formation of PTSD. To meet the diagnosis requirement, individuals must meet a certain criteria in the DSM-5. As you know, the DSM-5 refers to the fifth edition of the Diagnostics and Statistical Manual of Mental Disorders. It is the publication of the American Psychiatric Association, and it serves as a standard for classification of mental disorders, commonly used by mental health professionals in the United States as well as other countries. According to the DSM-5, individuals must meet at least one of the following requirements for them to have the possibility of PTSD as their diagnosis. These requirements include directly experiencing the traumatic event, witnessing in person the event as it occurred to others, discovering that a close family member or close friend experienced the horrific event. The event must have been violent or unintentional in circumstances where family member or friend has really died or has been put in the way of harm. And lastly, being repeatedly or intensely exposed to the upsetting aspects of the tragic event over time. The last requirement does not apply to sources of media such as broadcasts, social media, movies, or pictures. The criteria listed in the DSM-5 apply to adults, adolescents, and children older than 6 years old, also experiencing these symptoms for more than 1 month. The symptoms of PTSD may begin either shortly after the traumatic event or months or even years afterwards. According to Serene in 2020, 25% of people with PTSD do not develop a full clinical syndrome until 6 months or more after their traumatic experience. As we know, post-traumatic stress disorder is a condition that potentially develops after a person has experienced a traumatic event, and the symptoms persist for longer than 1 month. The symptoms of PTSD can include additional symptoms such as emotional numbness, persistent feelings of guilt or shame, and significant changes in behavior or personality. Individuals must portray at least one or more symptoms over the time period of 1 month. Intrusive thoughts and memories. This can include reoccurring or unwanted memories of the traumatic event, nightmares or flashbacks to the event, or intense emotional distress when exposed to reminders of the trauma. Avoidance and numbing. This can include avoiding places, activities, or people that remind you of the traumatic event, feeling emotionally numb or disconnected from others, or losing interest in activities that you used to enjoy. Avoidance of or efforts to avoid external reminders such as people, places, conversations, activities, objects, and situations that arouse distressing memories, thoughts, or feelings closely associated with the traumatic event. Another symptom is hyperarousal. This can include feeling of constantly being on edge, easily startled or frightened, having trouble sleeping or concentrating, or being irritable or angry. Changes in mood and cognition. This can include negative thoughts or feelings about oneself, others, or the world. Feelings of guilt, shame, or hopelessness, or difficulty to experience positive emotions like happiness or love. According to the DSM-5, changes in mood such as irritable behavior and angry outbursts are sub-PTSD symptoms, typically expressed as verbal or physical aggression towards people or objects. Another sub-symptom stated was reckless or self-destructive behavior, hypervigilance, which is the elevated state of constantly assessing potential threats around you, possessing an exaggerated startle response, demonstrating problems with concentrating, maintaining focus for periods of time, and sleep disturbances such as difficulty falling or staying asleep. These symptoms can significantly impact a person's daily life and make it difficult for them to function normally. PTSD symptoms can vary in intensity and duration, but keep in mind, not everyone who experiences a traumatic event will develop PTSD. There are several ways to receive treatment. Some perspectives having a positive influence on people more than others. Like many with mental illness in this field of study, it is important to note that PTSD treatment is not one size fits all approach. Different treatments may work better for different individuals. A mental health professional can work with individuals to determine the best treatment plan for their specific needs. Treatment for PTSD can involve a combination of therapy, medication, and support from family and friends. Certain medications, such as antidepressants and anti-anxiety medications, may be used to help manage the symptoms of PTSD. Increased arousal, unpleasant emotions, the disorder's recurrent traumatic memories, dissociative experiences, and avoidance strategies. General PTSD symptoms are better treated with these drugs than other medicinal approaches. Antidepressant treated PTSD patients, and half of cases report some symptom improvement in some form or fashion. Cognitive behavioral therapy, or CBT, is often used to help individuals learn how to cope and manage with their symptoms. Cognitive behavioral therapy has been proven to be quite successful in treating PTSD. Cognitive processing therapy is a form of CBT. This form of treatment assists patients in recognizing and altering harmful thinking, behavioral patterns that are creating or aggravating their PTSD symptoms. Exposure therapy. The goal of this therapy is to progressively expose the patient to a traumatic event or the circumstances that causes their symptoms. The objective is to assist the person in facing their anxieties and regaining control of their emotions and ideas. For example, slowly getting a car accident victim back behind the wheel with small tasks over time, slowly desensitizing the individual from their trauma. Getting into the film, let's begin with Stephen Knight. Stephen Knight is a British screenwriter, film director, and television producer. He was born on December 17, 1959 in Marlborough, England. Knight started his career as a screenwriter in the 1990s and has since written and directed several successful films and TV series. Some of his most notable works include the film Dirty Pretty Things in 2002, Eastern Promises in 2007, and Locke in 2013, as well as the film series we will be discussing shortly, Peaky Blinders. It started in 2013 and ended in 2019. And Taboo, the current project he was working on, which began in 2017 and which is presently still an ongoing series. Knight knew about this condition personally and professionally. Knight sought advice from his uncle, alongside actual troops, about their experiences with PTSD. Reintegrated into society while developing Peaky Blinders, as well as another one of his projects called Hummingbird, which is a movie about the post-war lives of Afghanistan veterans. A quick overview of the show is that it is based around a criminal family centered in Birmingham, England. Yet, underneath the surface of the film, it explores how its cast members manage the traumas they brought back from the front lines of World War One. The gang was known for wearing distinctive flat caps with razor blades sewn into the brim, which they would use as weapons in the fight standard. It is set up in the aftermath of World War One, where our MC Thomas Shelby has returned home a war hero, doing whatever it takes to make a name for himself and his family. During times of war, men were drafted ranging from ages of young teenage boys to fully grown men. As we know, the young adolescent brain is very malleable, letting trials and experiences shape us into the individuals we are growing into adulthood. The Battle of Verdun is one notably distressing incident that is covered in the film. This First World War fight, which raged from February to December 1916, is regarded as one of the deadliest conflicts in history. Tommy served as a clay kicker, also known as a tunneler, during the First World War. They planted bombs while tunneling behind enemy lines. So as you can imagine, it was the most confining, terrible, and gloomy profession you can have during this time of war. Sometimes coming face to face with enemies in these dark, wet, and closed spaces, with no choice but to act. Thomas's condition can be traced back to the conflict where he nearly lost his life via drowning while fighting an enemy soldier in the enemy tunneling system. The DSM-5 states that directly experiencing near-death, high stress, or violent interactions can be classified as a traumatic experience. Thomas Shelby and many other young Englishmen that were drafted, including his older brother Arthur and his younger brother John. They all took part in this conflict and sustained serious injuries, specifically Thomas, who had been struck by shrapnel during one of his missions. These experiences following may have led up to his ongoing mental health problems. However, the show only goes into depth about Thomas's position and events prior to returning home from the war, and not Arthur and John's. Awarded the rank of a sergeant major, Thomas Shelby is a different person when he returns from the war. It has been mentioned multiple times throughout the film from his sister Ada and his aunt Polly that he has become emotionally distant and stopped enjoying the things as he frequently did before he left. It is implied throughout the entire series that Thomas Shelby suffers from post-traumatic stress disorder as a result of his wartime experiences. For example, wanting to rid himself of items that would remind himself of any memories of his past. Once he returns to his hometown in Birmingham, England, he throws his military medals into the river for them never to be seen throughout the show again. This was his personal attempt at dismissing the man he was during that time period, before becoming the persona, the gang boss known as Tommy Shelby. In addition to experiences in the war, Thomas Shelby also experiences significant trauma throughout the series as a result of his involvement in organized crime. He is constantly under threats from rival organizations, and he must make difficult and often violent decisions in order to protect himself and his family. Throughout the show, he commonly has sleep disturbances in the form of memories, thoughts, and dreams replaying events of his past during his time in the trenches. He is also frequently shown to be hypervigilant, as we discussed earlier, with anxious traits, being tense in times of relaxation, with no found stressors present. Also, in earlier seasons, he is shown to have trouble managing his emotions, resulting in reckless or self-destructive behavior. These symptoms being mentioned, according to the DSM-5, Thomas Shelby portrays two or more symptoms that can be used to classify PTSD. Moving on to his two siblings that were drafted into the war, the oldest son of the Shelby family, Arthur Shelby, also harbors some of the same symptoms as his younger brother Thomas. Only in this case, his symptoms reside on the more severe side of the spectrum. Shown to have trouble controlling his emotions on multiple scenarios where he demonstrates violent outbursts, resulting in verbal or physical altercations. During the film, there is an incident where Tommy's older brother, Arthur, has an episode and accidentally kills his opponent during a bare knuckle sparring match. These bouts of anger and flashbacks are both symptoms in the DSM-5 that can help identify post-traumatic stress disorder. Moving on to the second youngest Shelby member, John. John returned from the war emotionally disconnected, able to commit unspeakable acts of violence without batting an eye during his time being involved with the Peaky Blinders. John has been shown to show aggressive and violent tendencies, not taking mind to the consequences or well-being of others when committing these acts. Throughout the film, these three take different approaches to dealing with this condition. None getting the proper help they need, considering mental health was not significant at all in the early 1900s. Instead, these three find their way turned towards violence, alcohol, women, and drugs, such as opioids, to help them cope. And finally, these are my references, which help me understand my topic better and further my research.